Our next question comes from Rosemary. Rosemary asks, I need to ask you about thyroid issues. I've had radioactive iodine done, and that affected my thyroid. And now I have to take thyroid medication for life. Is taking iodine like this? Is taking iodine from Organixx recommended? Thanks, Rosemary. Okay, Rosemary, this is a really great question because it depends. And I hate to be non-committal, but this is really where individually we need to address your body, your thyroid health, and the overall balance of minerals and key nutrients necessary for your body and your iodine receptors to be open to absorbing, assimilating, and using iodine in the most effective way. And this is really, really critical. It's not so much about whether the iodine from Organixx will work or not in terms of its potency. It's a highly powerful, potent product. But what we need to do is we need to make sure that your thyroid gland will not be overwhelmed or charged up in a way that we have a situation that we call the thyroid storm. And basically that means we overactivate the thyroid function. And if you are dealing with hypothyroidism, it could further exacerbate it, particularly when you go off of the iodine or within 3 to 4 weeks of taking it, you kind of have an increase, you're feeling great, and then we have a crash. We want to avoid that. So there are a few things that I recommend with my patients. The first most critical thing is to actually do a test. So I recommend for my patients that we test their iodine levels. This is a blood spot based test that you can easily do at home or call your clinician and have your iodine levels assessed. Similarly, we want to get essential elements like selenium and chromium. We want to identify the kind of best friends, if you will, in the body of iodine that help iodine be absorbed the best. And what we find is chromium and selenium both equally need to be in an optimal state for iodine receptivity to be optimized, but also to be articulated in the most healthy way. So I will tell you this, I do have patients who have had thyroid removal. They've had their thyroids radiated. They've even had nodules or partial removal of the thyroid gland and are able to take iodine. But it is a case-by-case basis. It's not something you want to do alone. And you definitely want to monitor very closely when you increase your iodine levels that you have labs drawn at minimum every 3 months. And that is a recommendation for anybody who is going to be taking iodine that maybe has a challenge or an imbalanced thyroid. That state of that imbalance, you can invigorate your thyroid in a healthy way with iodine, but we need to monitor that. We need to closely monitor it so that we don't get in a situation where your iodine might trigger a thyroid storm or even exacerbate your situation. I hope that helps. Let us know how that goes.